My name is Mirzayan, and I'm a practicing dentist in downtown Los Angeles, California. My wife and I, who's a dentist as well, started our practice from scratch a good dozen years ago, and we've been really thrilled with how far the profession has taken us. Today, we're going to talk about NX3 resin cement and all its applications, particularly with how it applies to ceramic restorations. One of the great features of the NX3 resin cement is that it is truly a universal adhesive resin cement. This means that you can use it with a total etch bonding agent or a self-etching bonding agent. Another great feature of this material is its superb color stability, which is due to Kerr's patented amine-free redox initiator system. The NX3 resin cement has many indications of use. Whether it's ceramic or metal, it doesn't matter. You can use it for inlays, onlays, partial crowns, or even PFMs. What I love about the system is a number of different color options that I have. I've got the option to choose clear, white, yellow, white opaque, or even bleach. So if I use the LiteCure resin cement, it affords me all the time in the world. If I'm seating 10 restorations, I can place them with the LiteCure resin cement, clean up at my comfort level and my leisure, cure them when I'm ready to cure them. As the dental assistant is preparing a ceramic restoration, personally, I'm getting the field ready for cementation. Isolation, suction, and hemostasis are absolutely critical for this process. Personally, I like to apply the XPasil product onto the sulcus around the restoration to gain hemostasis. It's imperative to allow enough time for the hemostatic agent to run its course and be effective. This usually takes a couple of minutes with XPasil. I then pack cord into the sulcus to prevent any hemorrhaging while I'm flossing around the restoration. Once I've got the tissue isolated, then I prepare the tooth structure for delivery. Ideally, you want to use a material that will disinfect the preparation if it's a vital tooth structure, get all the bacteria removed from the tooth structure. At this point, I like to either, if I'm doing a total etch technique, use a phosphoric acid etchant, rinse it off, and dry it, but do not desiccate. With non-traditional preps and relying on enamel and bond strength to retain my restorations, it's very imperative that I absolutely bond correctly to the tooth structure. What NX3 allows me to do is, for one, I love the way the ceramic restoration blends into the rest of the tooth structure and you can't delineate where the margins are. So the color stability or the color options I have really pronounce that for me and make the restoration look very aesthetic. As you know, there's some intricate steps you need to follow very diligently to make your restorations last a long time and be a great success for you. Let's first talk about how to treat the ceramic restoration. You must hydrofluoric acid etch the restoration, rinse it off, dry it, apply a silane, and thin that out. After silanation, you need to bond your resin agent onto the ceramic restoration. Fortunately, Kerr has a silane that has the bonding agent built into the mechanism and the chemistry. So you can apply both of those things, thin it out. What's important to understand in 5th generation bonding agent is that you have the primer and the bond, and one's hydrophobic, the other one's hydrophilic, and they're mixed in one bottle. To summarize why to use the OptiBond Solo Plus and NX3 resin cement materials, because it affords me great ease of use and great predictability. When I committed to placing all ceramic restorations, I really struggled with bonding. The whole process was very intricate and technique sensitive, and I really struggled. But now, with the combination of the OptiBond line of bonding agents and the NX3 Universal Resin Cement, a lot of those issues are addressed for me. The ease of cleanup, the color stability, and the long-term results I'm seeing on these restorations on recall really make NX3 my resin cement of choice. Looking at the sheer bond strength of NX3 to dentin and enamel using OptiBond Solo Plus, you can tell that it's well above the accepted range of 20 to 25 megapascals. Generally, the industry standard is if you're above 25 megapascals in sheer bond strength, that's a very acceptable cement to use for bonding restorations. You can clearly see NX3 is well above that range, both bonding to dentin and enamel. Looking at this chart that publishes the sheer bond strength of NX3 to various substrates, you can see how well the material performs. The thing that's most surprising to me is how well it bonds to gold, but predominantly most of my work is Emax, lithium disilicate, and ceramic restorations, both CEREC and lab processed ones, and they're clearly above the acceptable range for bond strength.
Another popular combination is NX3 and OptiBond all-in-one. The unique advantage here is that the bonding protocol is simplified, but still allows for a good bond between the prep and cement interface. NX3 is quite compatible with OptiBond all-in-one and yields excellent bond strength regardless of whether the cement is self-cured or dual-cured. When using OptiBond All-in-One, brush the adhesive on the prep area for 20 seconds and repeat the step. It is very important to carry out this step in full. After the application of the adhesive is complete, air dry the prep for 5 seconds and light cure before applying NX3. This chart here shows the shear bond strength of NX3 to dentin enamel when using OptiBond All-in-One. Whether it's dual cured or dark cured, bond strengths to dentin are over 30 megapascals. Bond strengths to enamel are over 26 megapascals as well, showing excellent bond strengths. NX3 can be used in combination with Kerr's newest addition to the OptiBond line, OptiBond XTR. OptiBond XTR is Kerr's self-etch, light-cured, two-component bonding agent. OptiBond XTR is effective enough to use in total dark cure mode with NX3 without being light-cured. In other words, when using NX3 and OptiBond XTR, light curing on the prep side is not required. Remember though, when using this technique, you must air thin the adhesive with maximum air pressure for 15 seconds prior to applying NX3. So when using OptiBond XTR in dark cure mode only, apply OptiBond XTR primer to the prep area for 20 seconds, air thin, then apply OptiBond adhesive for 15 seconds onto the prep area, and finally, air thin the prep for 5 seconds if light curing after, or 15 seconds to use in dark cure mode before applying NX3.
This chart shows the shear bond strength on dentin and enamel when using NX3 and OptiBond XTR. Whether dual cured or dark cured, NX3 and OptiBond XTR shows exceptional bond strength to both dentin and enamel without a separate etching step.
This chart here shows the shear bond strength of NX3 and the new OptiBond XTR. It works on a variety of materials from dentin to lava and composite, which all show bond strengths of over 35 megapascals. This chart shows that NX3 truly does have universal capability.